Hi, I'm Dr. Adam Abbs, and today we're going to talk about how to undertake a neurological examination in a remote consultation. We'll start with the cranial nerves. Most cranial nerves can be examined online. You just need to modify the examination a little bit. Here are a few things you can try. So, number 1, the olfactory nerve. Ask the patient if they lost their sense of smell. Number 2, the optic nerve. Ask the patient if there's been a decline in general vision or any loss in the visual field. If in doubt, you can ask the patient to read from a book or a newspaper. Then 3, 4, 5, oculomotor, trochlear and abducens nerves. Ask the patient to keep their head still and move their eyes slowly from left to right. As they do this, observe the light reflection in the eyes. It should be the same in each eye, wherever the eyes look. If there's asymmetry, this suggests a pathology of the motor nerves. At this point, you can also observe for any nystagmus, and this will allow you to assess the 8th nerve. 6. The trigeminal nerve. Ask the patient to use a soft object, such as a twisted tissue, and stroke their face in all 3 zones of the trigeminal nerve, comparing left with right. Whilst they're there, ask them to rub the temporal areas to assess for tenderness to the temporal artery. Ask the patient to open and close their mouth, like that, and move the jaw from side to side, like that. Again, you're looking for any asymmetry. For the facial nerve, assess the patient for facial asymmetry, which you will surely do whilst the patient is just talking. But you can also ask the patient to raise their eyebrows, and close their eyes tightly, to blow out their cheeks, and finally smile. The 8th vestibulocochlear nerve, you can ask the patient to rub their thumbs and fingers quickly next to their ears and report any asymmetry. If there is asymmetry, use the hum test that we discussed in the ENT video, and this will help to differentiate between sensory neural and conductive hearing loss. You can also ask the patient if they've been feeling dizzy or drunk or like they're on a boat recently. The 9th, 10th and 12th are the glossopharyngeal, vagus and hypoglossal nerves. Here you need to ask the patient to cough, ask the patient to stick the tongue out and say ah, and you'll be assessing the asymmetry of the uvula or the tongue, and you'll also be looking for any fasciculations or wasting of the tongue. Finally, for the 11th, the accessory nerve, ask the patient to shrug the shoulders as high as possible as you assess for any asymmetry. To assess sensation, patients can use something like a twisted piece of tissue. They can't use their own finger though. Gross loss of power can be assessed online with a few movements. Upper limb power can be grossly measured by assessing pronator drift with 92% sensitivity. So ask the patient to hold this whilst answering a few questions. Lower limb weakness in the lower limbs can be screened for by asking the patient to squat down and then stand again, then stand on the heels and then stand on the toes. And here you'll assess L3, L4, L4, L5 and S1, S2. For coordination, the finger-nose test can be done by asking the patient to move arm's length back from the screen, pick a specific point next to the camera, and then alternate between their nose and that point on the screen. You'll be able to see any hesitation. In particular, you'll be looking for any sudden changes in direction, such as this would suggest some dysmetria. For the gait, ask the patient to walk to the furthest end of the room and back, putting one foot in front of the other, heel to toe. For cerebellar signs, you can assess for Dysdiadochokinesia as well online as you can do face to face. You'll need to give clear advice whilst demonstrating to the patient. Put one hand on the top of the other, turn the top hand over and back again, and now do that quickly for me. The rhombose test can also be carried out if there's somebody who can steady the chair behind the patient in case they fall. Muscle wasting and fasciculations can be assessed by asking the patient to remove certain areas of clothing. Don't forget to assess for signs or symptoms of cauda equina in patients with lower back pain or lower limb symptoms. Loss of power or sensation in one or both legs, bilateral leg pain, saddle anesthesia, so altered sensation when wiping following toileting, any bladder dysfunction, retention or incontinence, or any bowel incontinence.